Hi, and welcome to another edition of Forward Living. Today's topic, stroke. Stroke, or a brain attack, is the fifth leading cause of death in the U.S. There are actually three different types of stroke. Ischemic, which means no oxygen, hemorrhagic, which means bleeding, or a transient ischemic attack, or TIA. An ischemic stroke happens most often, over 80% of the time. This happens when the arteries that supply blood and oxygen to the brain get blocked. A hemorrhagic stroke occurs about 15% of the time. This happens when the arteries that supply blood to the brain leak or burst open. Then the surrounding blood damages the brain cells. When oxygen to the brain is deprived for a short period of time, this is called a TIA, a transient ischemic attack, or a mini stroke. Just like with heart disease, high blood pressure or hypertension is the number one risk factor for developing a stroke. Oftentimes, there's no signs or symptoms of hypertension, so it's very important to check with your doctor to monitor this risk factor. Another major risk factor for stroke is diabetes. In uncontrolled diabetes, sugar remains in the blood and can attach to the red blood cells, which affects their oxygen carrying capacity. As with many chronic disease, lack of physical activity can increase your risk of having a stroke. Just 30 minutes a day of moderate to intense physical activity can greatly decrease your risk. Eating a nutrient-dense diet, increasing physical activity, reducing cigarette consumption and alcohol consumption all reduce your risk of having a stroke. Not only that, it also increases your chance of leading a fulfilled, healthy life. As always, if you have any questions or need any more information, contact us at care@catalyst.com. Be happy, be healthy.